A sign-in log should be signed anytime someone enters or exits the isolation unit. Next, check signs and alarms. If an anteroom nurse is present, she will open the door from the inside. Once you enter the anteroom, proceed directly to the locker room without touching anything in the room. The locker room is only opened when someone is entering or exiting the locker room, otherwise it stays closed at all times. Doorknobs and handles are wiped every time a door is opened or closed. Once in the locker room, you should first open the locker, remove all jewelry, and then completely disrobe. Place all street clothes in the locker and close it. Then put on disposable underwear, socks, and scrubs. All medical workers assigned to the ISO unit are required to bring in shoes that will remain in the unit. They will wear these shoes while working in the unit and leave them in the locker room when it's time to leave. Once dressed in your disposable clothes and ISO unit shoes, you can re-enter the anteroom. Once in the anteroom, put on the belt which will hold the battery for the air unit for the helmet and hood. The next step is to check the helmet to see if the battery is working. A fully charged battery will show 3 green lights. If the 3 green lights don't appear, you will need a replacement battery. Once you've determined that the battery is working, you would disconnect it and then secure it on the left side of your belt. The cord is connected to the helmet on the left side, and you want to avoid having it cross your body. The helmet has to fit properly. An adjusting knob in the back tightens or loosens it so that it's snug but comfortable. You should move your head back and forth and sideways to make sure there is no slippage. Now the helmet can be placed inside the hood. The white part of the hood is the HEPA filter, and it goes on the top. Using 4 fingers inside the helmet, with the thumb on the outside, slide the helmet into the hood until it snaps. Then snap each side. Then set your helmet aside. Now it's time to put on your overalls. You should choose a size larger than what you would normally wear so that you'll be able to move around in them comfortably. Shake the overalls loose and unzip it. Put your feet in first. Once you put your arms in, then zip it part way up. You'll be wearing 2 pairs of gloves, an inner and an outer pair. So that there's no mistaking which is which, they should be 2 separate colors. In this case, the shorter blue gloves will serve as the inner pair. Pull your sleeve down and hold it, putting the glove on over it. Once the inner gloves are on, they should be taped down using a single layer or 2 of masking tape, securing the gloves to the sleeves of the coveralls. At this point, you should check to see if you have enough room to move around comfortably in the coveralls. Next, put on the outer gloves. In this case, the outer glove is green and longer than the inner glove. Now it's time to put your booties on. A stool can be helpful. Remember to sanitize frequently, especially after you touch something like your booties. Next, you would put on your apron. The apron is used as an added layer of protection against bodily fluids. You're almost ready to put on your helmet, but first drop the excess cord down behind the apron and plug it into your belt battery. Put your helmet on, letting the hood drape around your shoulders. Tie the apron in the back, and then straighten the hood draping and tie it down. The hood should be secured snugly, but not overly tight, around the neck. After checking the room and monitors, you can now enter the patient's room. The anteroom nurse should wipe down the door handle after you enter.